There are a number of conditions that cause arthritis of the hip joint. Some are congenital, we get them by birth, and others are acquired as we get older. They may all lead to a degenerative condition of the hip, which in most patients will cause pain, stiffness, and a loss of function. Now, the natural progression of any arthritic hip joint is that ultimately it will get stiffer and stiffer until it fuses up altogether. Now, that is very useful because a joint that doesn't move will not be painful, but at the same time, the function of the hip joint is much reduced. And this is where an orthopedic surgeon can help out with a total hip replacement. Now, total hip replacement in its present form was popularized in the late 60s and early 70s, mainly by Sir John Charnley, but others who worked out of Wrightington. Hip replacement is very good at relieving the pain, making the joint move again, and returning the patients back to normal function. Most patients with a painful hip secondary to arthritis will try and avoid having surgery. They try and optimize their conservative management. This can be by taking painkillers such as an anti-inflammatory or paracetamol, maybe the help of dietary supplements such as glucosamine, chondroitin sulfate. Maybe the patient might want to lose some weight or have the help of a physiotherapist. However, at some stage the symptoms might become quite obtrusive. Patients may get pain at night, which will stop them sleeping. They may have a reduced function of their hip, which may make it difficult to walk any distance or to put on their socks and shoes. At that stage, they may come and discuss with their orthopedic surgeons the possibility of going forward for a total hip replacement. The patient has decided that they wish to go forward for total hip replacement. It is probably in their best interest to make sure that they both physically and mentally prepare for such an operation. It is a good idea for the patient to be in the best possible shape for undergoing the operation, and this means optimizing medical conditions, but also making sure that they're physically as fit as they can be. This may be helped by the assistance of a physiotherapist or even a gym person to make sure that the patient is as fit as they can be. This means that post-surgery the rehabilitation is much easier and the patient will regain the function after hip replacement as quickly as possible. If a patient decides they would like to come forward for total hip replacement, they will be seen by a medical person to make sure that they're medically fit and well to go forward for the operation. Quite a few patients are concerned about the amount of pain that they may be in. The anaesthetist will discuss with the patient the type of anaesthetic. Most commonly, most people will have a spinal anaesthetic. That's a needle in the back and then they become numb from the waist down. And at the same time, they will get some sedation, and most patients elect to be completely unaware of the operation. From my point of view, I believe we work sometimes like glorified carpenters, but we try and reconstruct the hip as anatomical as we possibly can. The actual mechanics of the procedures, we have to make an incision to get to the hip, but we use components that are either cemented or uncemented, and we replace the femoral part and the socket part of the hip replacement. Prior to the operation, we do x-rays, we have various procedures that we carry out before, during and after the procedure to make sure that the hip will function as naturally as possible. Most patients will stay in hospital for 2 to 5 days. Most patients will be mobilized on the day of surgery, if not the following day. And most patients will be able to go up and down stairs either by the first or second day after the operation. Most people will have some crutches, probably for 2 to 3 weeks after the operation. Most people will have to drive their car either between 4 to 6 weeks after surgery. If it's your left hip and it's an automatic car, you're probably more likely to drive it 4 weeks rather than 6 weeks. I tend to have a lot of people who play golf in my practice, and chipping and putting is allowed at 6 to 8 weeks, and most people will be able to play a proper round of golf by about 3 months. People play tennis or bowls or any such sport, or walk the dog or do gardening. 3 months is about the time that most people can do those sort of activities. At about 6 to 9 months, most people do very well. They forget about the operation and they can do most things and forget that they've ever had a hip replacement. Little niggles can take up to a year to 40 months before they get better. Total hip replacement is one of the most successful operations that surgeons can do. In fact, 95% of patients are very happy with their joint replacement as compared to 85% of patients having total knee replacement. Clearly, a complication can happen. They are rare. Probably 1 in 100 patients, 1%, will get some form of a complication. The most common ones are infection, which is rare. Most patients get given antibiotics before and after surgery. Dislocation of the hip popping out of joint, again very rare. Damage to nerves and blood vessels. Sometimes a patient can develop a clot in the leg vein called a deep vein thrombosis, which can then go up to the lung and cause a pulmonary embolism. Again, the patient will be given medications before, during and after surgery to stop that from becoming a problem. Very occasionally, patients will get a leg length problem. One leg, usually the operated one, is a little bit longer than the other. A shoe race is then often applied, and this will hopefully return the gait to normal.